All right, guys, welcome back to episode 2 of Healing at Home, the Truth About Advanced Wound Care series. And if you watched episode 1, well, you know my why. We talked a little bit about what drives me to do this line of work and why I feel like it's so important. But today, I want to share something equally important. And this is the mission, the vision of Rebirth Advanced Healing and what actually sets us apart from other wound care providers and other options out there. Because here's the thing, there's a lot of companies, there's a lot of great companies that treat wounds, but not all are created equal. And by the end of this episode, you're going to understand really what sets us apart and why this actually matters for the patients and the families that we serve. So let's get right to it. So let me start with our mission, I suppose. And at Rebirth, our mission is simple. You can find it right on our website. It's to deliver advanced wound care that comes to you. So you can heal at home, can get back to living your life with independence, with dignity. And I'll break that down because every single word in that statement matters. Advanced wound care. We're not talking about like basic dressing changes. What we're talking about here is sophisticated evidence-based treatments using advanced biologics, therapies, including amniotic grafting, and the kind of care that was traditionally only available in hospital centers, specialized wound centers, clinics. So we come to you. Now this is critical because we have the ability to bring, well, advanced level care directly to wherever you call home, your house. Maybe if you live in senior living, an assisted living facility, a nursing facility, even to your bedside, if that's where you're most comfortable. This way, well, you can heal at home. Because fundamentally, we believe that healing happens better in familiar environments, right? And we know that the research supports this. But more importantly, every patient tells us, they tell us this every single day. And for you to be able to get back to living your life with independence, with dignity, this is really the heart of it. Because we're not just closing those wounds, although we do that, we're restoring lives, right? We're giving people back their ability to walk, to garden, to play with their grandkids, and to feel like themselves again. So that's our mission. And everything we do is filtered through that lens. So now, in terms of like the vision, right, this is where we're headed. We're envisioning a future where every senior with a chronic wound, they have access to advanced, coordinated home-based care, regardless of where they live, what their circumstances are, because right now, and you know this, our healthcare system is fragmented. Patients are bouncing between different providers, they're getting conflicting advice, and they're traveling to wound centers where they can barely walk and get out of the house. And worst of all, they're suffering with these wounds for months, or even years because, well, they haven't coordinated the care properly or escalated them to advanced treatment sooner. And it's just simply not acceptable because our vision is to change that paradigm entirely. We want to create a model where mobile advanced wound care is the standard. It's not the exception, where early intervention is the norm, where every patient has a wound care specialist who actually comes to them, works alongside their existing care team, and uses the best technology available to heal them as quickly as possible. And so here's what's more exciting, right? Because we are expanding rapidly. And we currently provide services in 23, 24 states now, and we're growing every single month because the demand is there. The need is massive. And more importantly, we know the model works. So when you bring advanced care to the patient, instead of making the patient come to care, we know the healing rates go up, hospitalizations go down, quality of life improves dramatically. And that's the future of what we're building. So let's actually take some time and talk a little bit about what sets Rebirth apart, right? Because I want you to understand the specific things that make us different. First and foremost, we are physician-owned. And this matters more than you might think. We're not backed by private equity. We're not in corporate conglomerates focused on quarterly profits. We're owned and operated by physicians who understand healthcare from the inside out, who understands what good patient care looks like, and who's built this company with clinical excellence, with patient outcomes as the top priority. That physician ownership means our decisions are made first with patients, not shareholders first. Number two, second, our providers are exceptional. They are the real deal. Every single one of our providers is either a nurse practitioner or a physician assistant. These aren't wound techs. They're not nurses doing basic wound care. We're talking about advanced level practitioners with prescriptive authority. And beyond that, they are wound care certified and trained as debridement specialists. So why does this actually matter? Because chronic wounds often need more aggressive mechanical debridement to remove a lot of that dead tissue, prepare the wound bed for healing, and our providers can do that. They can assess these complex wounds, they can make clinical decisions in real time, and they can prescribe medications if needed. That level of expertise makes a massive difference in healing outcomes. And now number three, we use advanced biologic grafts when appropriate. Specifically, we use amniotic membrane grafts, and they're ethically sourced from planned cesarean section donations, donated placenta from healthy baby births. And they undergo rigorous testing, right, to ensure safety, to ensure quality. And these grafts, like, why do they work? Well, they're packed with growth factors, cytokines, extracellular matrix, right? That's a lot to say, a mouthful, that actively promotes tissue regeneration. And they're not just like covering the wounds, right? They're helping the body restart its own healing process. And it's really life-changing technology. And we're bringing it to your home every single week. That's number three. Now, number four, I think this is super important. Number four is our partnership approach. We don't replace your existing healthcare team. We work right alongside them. Your home health nurse is still your home health nurse. Your primary care doctor is still overseeing your care. We come in as the wound care specialists who integrate seamlessly with everyone else. And in fact, we provide weekly updates, actually 3 times a week, to your entire care team. Your home health agency gets detailed documentation. Your doctor gets reports. Everyone stays in that loop because coordinated care is just better care, period. So that's huge. Now, number 5, right? We take the burden off of you. Now, you know what most people don't realize is when you go to a wound center, sometimes you have to pay for your own wound supplies. You have to get there somehow, which often means, well, arranging transportation. And you're sitting in a waiting room with pain, your wound. With us, well, as the name implies, right? Mobile wound care, we come to you. We bring everything you need. We cover the cost of the wound supplies for the visits. We'll work around your schedule. And this way, it's this stress-free experience, the comfort of being in your home that matters most for your healing. And lastly, our results. Now, we can talk about all of these amazing things, but at the end of the day, it does come down to, can we actually deliver on the promise, which is to improve, to heal the wounds of the patients that we see. So now in Q2 of last year, we actually achieved a 98.6% healing rate. So I'll say that again, 98.6 of our patients saw their wounds improve. Now, that's not healed completely. This is their wound has actually improved. And many of these wounds had stalled out for years and hadn't had any progress. So super important that we kind of make that distinction. The second part of this is our rehospitalization rate related to wounds was only 1.6%. Now, when we look at this, they're not just numbers, they're not statistics. These are real people at home who had improvement in their wounds, who healed at home, who avoided rehospitalization who got some of their lives back. And that's really it. That's what sets us apart. But here's what I want you to understand. Right? All of these things, the physician ownership, certified providers, the advanced grafts, partnership model, results, they all come back to one core belief. And it's that you deserve the best care possible. And that care should come to you. And because chronic wounds can be isolating enough, they're painful enough, they're discouraging enough. And you shouldn't have to struggle to get appointments. You shouldn't have to navigate that fragmented healthcare system that we were talking about earlier. And you shouldn't have to settle for good enough care, especially when advanced options exist. And that's why Rebirth is here today. And that's why we do the things we do. So that's our mission. That's what makes this different. And if this resonates with you, again, I'll ask you, please make sure you're subscribed to this, because we're just getting started with this series. This is only episode number 2. Because the next one, we're going to actually talk about something really important, those hidden struggles that chronic wounds create. Because not just the physical wound, but the emotional toll, the isolation, the loss of independence. It's going to be maybe a bit of a deeper conversation. And I think that it's one that a lot of people need to hear. So again, drop a comment. Let me know what matters most to you when choosing a healthcare provider. Is it the results? Is it the convenience? Is it the relationship? I want to hear from you. So until next time, take care of yourself, and I'll see you in episode 3.